What a way to kickstart our Digital Futures webinar than with our very first presenter. Let me introduce to you the amazing powerhouse, Vanya Bosiocic. Vanya will be sharing her journey and lessons learned from a winding career in STEM and what inspired her to pursue a PhD in using remotely piloted aircraft systems to improve remote healthcare delivery. She'll also share her thoughts on how COVID has accelerated our understanding and acceptance of the benefits that drone technologies can offer. She's completed her undergraduate degree in ecology and animal physiology. She's worked as a science communications specialist, developing engaging content, marketing and communications campaigns for universities and research institutes. She's also in the process of integrating remotely piloted autonomous systems into the healthcare system of the NT, with a focus on saving healthcare delivery to remote and Indigenous communities. This absolute powerhouse of a woman, I am proud to introduce to you Vanya Bosiocic.
Thank you so much, Amanda. I would like to start off firstly by acknowledging the traditional owners of Larrakia country and paying my respects to elders, past, present and emerging. So at the end of last year, I was faced with a COVID-induced roadblock in my career. Before COVID, I was leading the development of Charles Darwin University's international partnership and engagement portfolio. This often involved working face-to-face with colleagues, travelling to meet international partners, attending international conferences and education fairs, and hosting international delegations. And then COVID happened. And when you have the word international associated with your position title, your profession, and the core theme of your everyday business, your career nightmares start to unfold in front of you. Overnight, the international education sector experienced the effects of closing international borders, and with it, the standard mobility pathways and engagement channels that were so fundamental to our work. As each month rolled on, I felt the effects of what it means for a global industry to not be able to quickly enough adapt to a disruptor such as COVID. As much as the sector did its best to adapt and change with the challenges that COVID threw its way by shifting to online learning and adapting and evolving the way that we were engaging internationally, the over-reliance on a business model that was based on face-to-face learning and freedom to be able to travel the world meant that when COVID struck, we were on the back foot. I soon realised that I needed to start to look in different directions towards my new career path. And to be honest with you, if someone had said to me a year ago today that I would be standing here speaking to you about doing a PhD in drone technology and healthcare delivery, I would have probably thought they were joking. But looking back now, I'm so glad that I did that, because this industry and this area of research has really inspired my mind and imagination and created a pathway for a new way of thinking and seeing the world. Even before I knew about the possibility of doing a PhD in drone and healthcare delivery, COVID had started to open my eyes to just how much technology and digital systems were becoming a necessity to our everyday life. With lockdowns and social distancing, what was keeping our economies afloat were internet-based services that were allowing us to communicate, interact, and continue to do our jobs from home. Furthermore, technology was saving our lives by expediting the development of vaccines and allowing us to model public health risk and implement effective measures to protect lives. As the pandemic unfolded last year, I became intrigued by the enormous potential that technology had in supporting our most vital asset, our public health system. I remember when we all first learnt that the COVID vaccine was developed. I remember thinking, yes, all we need to do now is just to distribute it out to everybody and everything will be fine. What I underestimated is just how difficult that word distribute would be. Because when COVID hit, our capacity to quickly transport vaccines across the world was weakened by the disruption to network connectivity of our international supply chains. And for the first time, I became acutely aware of just how much the strength of all of our healthcare systems are dependent on the efficiency of supply chains. Coincidentally, at this same time, I learned about a program that was being launched by Charles Darwin University in partnership with the Northern Territory Government's Department of Health and the Federal iMove Cooperative Research Centre. The program is called Drones for Life, and its main objective is to look how we can transform the delivery of medical supplies to remote communities using remotely piloted aircraft systems, or better known as drones. This really sparked my interest, especially because I was aware at the time that drones were increasingly being used by many industries to enhance mapping, data collection, and monitoring operations. However, at the time, I didn't know much about drones being used in healthcare, or even if the healthcare sector would see value in using drone technology. From my career experience in research and science communication and engagement, I knew this was the first place we needed to start asking questions, because if people don't find value in a solution you're offering, it can create a roadblock to progress. I learnt this lesson the hard way. When I finished my degree in environmental science, I went on to do an honours degree in further research at the University of Adelaide, where I worked in a lab that was developing a new methodology for studying the evolution of the human brain. And using the principles of comparative physiology, physics, and maths. The research we did was praised by the physiology community. However, such recognition and acceptance was not as forthcoming from some people in the evolutionary science discipline. At the time, I remember feeling a sense of disappointment and frustration with the fact that a research area I was so passionate about was being held back by rigid skepticism towards new ideas and the unwillingness to come to the table and consider a problem through a different research lens. What I later realised is that the skepticism was born from a lack of understanding. So my team and I went back to the drawing board and we shifted our way of thinking, and we invited anthropologists and evolutionary biologists to collect data with us, to discuss the ideas, to analyse it from all of our perspectives. And even though we applied the same methodology in data collection, the outcomes started to become very different. Our research was now being understood by the wider scientific community, and it was gaining acceptance. I did learn some important lessons through this. One was that resisting change will ultimately limit our capacity to develop and test new solutions to problems. And that to grow the success of any innovation, you have to take people on the journey with you so that they're invested in the tools and solutions you are developing rather than just being bystanders of its process. Because one of the biggest threats to the success of any idea is to leave behind the very people who benefit most from the solutions that you're offering. So fast forward to the end of 2020, and I knew that I wanted to be part of this research journey. I wanted to take the lessons I'd learned from the past and build strong methodologies that will allow us to understand the problems that we can address using drone technology from the perspective of healthcare workers and the communities they serviced. So thanks to the support and generous funding from the Cooperative Research Centre for Developing Northern Australia, I started my PhD journey towards understanding how drones could improve healthcare delivery in the Northern Territory. I spent months and months reading through every research article I could get my hands on, as well as going out and consulting with the team with remote healthcare providers, Indigenous health boards, regional councils, pharmacies, pretty much anyone who'd take my call. I also spoke to some of the world's best drone experts and innovators who currently work for the United Nations, USAID, and Global Aid Fund. And what I found was that we currently have the technology and the digital systems that support that technology at our fingertips. We have airframes and the digital tools that can fly drones for a distance of up to 800 kilometres and transport quite heavy cargo. And that for the past decade, the global drone industry has been piloting and testing the drone technologies needed to transport and deliver medical items. And research has been validating this use. Companies such as Zipline, Swoop Aero, Dove Air and Wingcopter have been partnering with global aid funders and humanitarian organisations to accelerate the application of the technology into healthcare delivery. And this was in developing countries. Their work showed that when distance is a barrier to accessing vaccines and medical items in developing countries, drones can help bridge the spatial gap in saving lives. But what is currently slowing down that mass integration of drones into global healthcare systems is that there isn't yet a clear understanding of the benefits and costs of using medical drones in first world countries. It was during my time talking and listening to healthcare experts and Indigenous-led health boards that I came to understand how drones might be able to service our healthcare system. In Australia, remote communities have lower access to healthcare services in comparison to their urban populations. And this can significantly impact the health status of our remote communities. And we're not alone in this global trend. Globally, the length of time it takes between patients in communities to travel to access healthcare at a health clinic is directly related to the prevalence of chronic and acute disease and the uptake of healthcare treatments in a community. And this is particularly important for us to consider in the Northern Territory, where we have 1% of Australia's population spread across a vast, climatically varied landscape of over 1.4 million square kilometres. Of our remote population, 70% are Indigenous and Torres Strait Islander peoples who experience poorer healthcare access in comparison to non-Indigenous Australians. To improve remote healthcare delivery, the Northern Territory has led the way historically in shifting many healthcare services closer to remote communities. And this has helped improve access to healthcare, but it has also come with its own challenges, including the increased pressure on our pharmaceutical supply chains to overcome the barriers of vast distance, varied hot and humid climates, and sparse freight routes in order to deliver time and temperature critical medication and vaccines to remote communities. Globally, most supply chains function under rigid end-to-end operating systems that are still heavily reliant on manual processing, centralised production, and just-in-time manufacturing. Now, couple this with the pressure of working under the constraints of COVID and the high demand for fast access to pathology tests, medication, vaccines, and protective equipment. And what you end up with is a system that is now enormously challenged to meet the demands of the new normal. Thermally sensitive medication, such as vaccines, are of significant concern. They need to be kept at temperatures that are between 2 to 8 degrees Celsius at all times. Up to 50% of refrigerated pharmaceuticals that are transported around Australia across state borders to reach the Northern Territory breach temperature thresholds even before they make it out to remote communities. This results in either the medication needing to be thrown away, a new medication ordered, or that the medication needs to be quarantined and checked to ensure that the potency has not been damaged during transport. Ultimately, what this means is that it extends the time it takes for our remote communities to receive the medication they need. Drones can help us overcome these barriers by shortening the time it takes to transport those medical items to communities and improve the efficiency of the last mile of the supply chain. In a time where agility and responsiveness is a prerequisite for our new normal, there's a clear need for pharmaceutical supply chains to be remodelled with digital and technological solutions. Therefore, understanding the costs and benefits of integrating drones into Northern Territory's pharmaceutical supply chain system is important to the future of not just medical drone delivery, but also healthcare delivery. Over the next couple of years, I'm planning with my PhD to work with experts in healthcare delivery, drone technology and operations, and Indigenous communities to help address this important knowledge gap. Because once we know that there are cost efficiencies and health benefits and improvements to workforce using drone technology, the sky's not even the limit to how far we can go in expanding the application of this technology in other areas of healthcare in Australia. And this is why I'm so passionate about being part of this new evolution of research and industry growth in the Northern Territory. COVID has, for the first time in our more recent history, aligned our priorities and values towards a common mission and provided a high enough viewing platform from which we can explore all the possibilities on offer by new and existing technologies. A vision like the one you see on the screen in Australia will require current and future research leaders, industry leaders and experts in health, the drone industry, digital technology, policy and regulation to come together and bring their diverse way of thinking and problem solving to the table. Most importantly, the table will need to be filled with women so that we can achieve the diversity of thought we need to create equitable solutions. And the exciting thing is that the drone industry is already being driven by leading, disruptive and innovative women who are making their voices heard.
Wow, that was so impressive, Vanya. I don't know if it's weird to clap on a webinar, but I'm going to do it anyway. Absolutely incredible. Thank you so much for all your work in healthcare for our remote communities in the NT. Now, I know that we've gone live to some questions. Please, everyone watching, our viewers, don't be afraid to write these questions in. Our presenters are very ready for you. We have a question, Vanya, from Laurel. She has asked, how long does it take for a drone to travel, say, 100 kilometres compared to a car?
That's a really good question, Laurel. Look, it depends on the type of drone that you're using. And obviously we have different types of drone technology that can transport different types of cargo at different weights and at different speeds. And their ability to be able to transport that is also dependent on their battery power, the digital systems and tools that are in place. So there isn't really one particular set answer. It really depends on the type of drone that you're using. And in my research and in the research that's being conducted at the moment as part of the Drones for Life program, we're still in that early stages of looking at which particular drones we're going to be procuring. And that's really based on us understanding what do we need to get out to those remote communities. Is it really big cargo and big medical supplies? Do we want them to be more agile and going from one healthcare centre to the other? These are all really important questions that will help explain and drive what type of drone technology we're using. So for this project, it's really important to start from the end user understand what their problems are, and then decide which drone technology will be best to address those problems.
I was going to say, because we have some harsh weather conditions in the NT, don't we? So,
yes.
I mean, even, the wet season can be quite full on. I guess, that depends on what kind of drones you're using.
Yes, absolutely as well. That is also something that's quite important. And I think the Northern Territory is the perfect place for us to test this, because we do, exactly, Amanda, like you said, we do have really varied weather conditions. We have different types of landscapes, but we do have also a flat landscape, which is really great for testing drones. But yeah, so the drones will need to also withstand our weather conditions, from dry season to wet season. And this is part of the decision tool that we're going to be implementing in deciding the type of drone that we're going to be using for it.
Amazing. Vanya, Wendy has also asked, is there evidence that the drones would cope with the heat in the Territory? Some very NT-based questions, yeah.
So there are some international examples where drones have been tested in harsh climates, and particularly in particular countries in Africa, and it has shown that they are able to withstand. But again, what we're talking about here in the Northern Territory is so unique. It's not like anything we've seen anywhere around the world. We have even greater distances to travel between communities and healthcare centres. That's just new for the world. And so this is why this is such exciting research, because this hasn't been done before. And there are lots of great questions that we need to answer before we start to implement drones into remote healthcare delivery.
Sure. Jess has asked, can you describe how the drones would be operated and how they land and how they're received in the communities?
Yeah, great question. So the drones will be piloted remotely, so it's beyond visual line of sight. So we would have actually a qualified pilot who would fly the drones, and there are digital systems and tools in there that allow the pilot to be able to see and navigate and land and take off with the drone. With regards to its acceptance in community, that's a really important process that we're going through at the moment, which is actually consulting and going out and consulting with remote communities to understand where would they like us to fly. Firstly, do they want us to fly? Where do they want us to fly? What considerations we need to take into account when developing flight paths? So this is part of the process and the research, the important research that I need to do and we're doing.
Yeah, fantastic. It's a process, right?
Yes, it's all a process.
Wendy has asked, is the training of the people to fly the drones, so the pilots, is that part of the PhD as well?
I would like it to be, yes.
Are you a pilot, Vanya?
Sorry?
Are you a pilot?
I knew this question. No, I'm not a pilot. Definitely not able to fly the drones that we're talking about. And I think it's important also for us, because it's hard to imagine. We think of drones as these little, relatively small devices, and we're quite used to them at the moment in many different areas of, recreational use, for example, drones. But the drones that we're talking about are quite big. They have big wingspans, and so they really need to have specialised pilots who have spent many years, flying planes and have the qualification. So although I would love to add that to my resume, my winding career in STEM, also be a pilot. No, I think I'm going to leave it to the experts in that regard.
Well, Vanya, with what you've achieved so far, I wouldn't write it off for your future. I think that it could possibly be in there. We're getting some fantastic, really positive comments coming through, Vanya. And Laurel has said how exciting this all sounds, and has asked about the timeline of the project until drones will actually be delivering. What's the timeline we can expect there?
So it's a 3-year, my PhD is a 3-year project, and the Drones for Life, which is my PhD thing, sits alongside that project, and it's feeding into the Drones for Life program, and the Drones for Life program is also helping with driving some of the direction in my PhD too. So it's a really great Mary there. So we're looking at 3 years. Over the next 3 years, we will be addressing some important questions, everything from community consultation, where we're going to be flying, what we're going to be transporting, how do we integrate it into the supply chain? Because that's a really important thing. You don't want the drones to be sitting alongside existing supply chains. You want them to be supporting, optimizing and increasing capacity of supply chains. Otherwise, you're doubling up on what you're doing. So we definitely don't want that. And so it'll be a 3-year process. We're looking at 3 years and we're so excited. I mean, so far the feedback we've received from many people that we've spoken to and consulted with is exactly that. It's a really exciting project and they want to be involved. They want to understand, where the drones can help. And we're really, we feel very fortunate to be working on this.
And for such a complex project, 3 years really does not seem like a long time.
No.
Yeah. We've had Eloise ask, have you looked at any other industries that are using drones currently, either in a research or commercial capacity for this project?
So for this particular project, I've focused on internationally where drones have been used in healthcare, because the application of drones, although there are many you can overlay a lot of applications. There are also a lot of specifics to your particular industry. So there is definitely industries, that are integrating drones into their operations, and it's really great because we're just helping each other. Each industry is helping by driving and integrating drones and testing and seeing what goes wrong and what's working well. It's helping drive that ecosystem of innovation and evolution, and that's what we all need. So although some of the applications are different, the fact that a lot of industries are starting to use drones means that we're going to accelerate the innovation of that technology.
How amazing. Laurie has asked, maybe she's a budding pilot, is the training available for drone pilots in the Northern Territory?
To pilot beyond visual line of sight, you have to be an actual trained pilot, but there are some exciting opportunities in the Northern Territory. I definitely encourage people that are interested in getting trained to to Google and have a look where you can do that across Australia and in the Northern Territory. But I'm really happy if you're really interested in that, send me through a LinkedIn. I'm happy to have a chat to you about your particular what you want to achieve, and where I could help guide you, and I can post that up on my LinkedIn as well so that other people can see too.
There you go, Laurie. Hit Vanya up. All right. We do have a bit of a double question here. Sarah has asked, do you have any idea how high the drones can fly as they travel? What are some of the risks of flying a drone in uncontrolled airspace? I imagine there would be a few.
Yeah. So again, how far up we're flying it's not going to be like, you won't be hearing drones or seeing drones very close to buildings or anything like that. Like, we're talking about if I give you a bit of an example, probably the same height as if you go to Kakadu and you go onto a scenic flight tour or something like that. That's the height that we're talking about those drones flying. So yes, so that's roughly how high up. And for the next question around risks, we need to look at obviously risks, and that's a really important part of this process, because we are working with CASA to get approval to fly the drones. So we do have to go through all the logistical and regulatory requirements to approve the flight paths, to make sure that the flights are, that they're not interfering with any other flight paths of planes or other commercial air operators. So it is a process that we're going through, but it's also really fantastic that we're starting to pave the way for that type of work. There you go. You can't just chuck them up whenever you want. It all goes through CASA and everything like that. It'd be a little bit weird if you're in a chopper or something and you just see this drone fly past. No, we definitely want to avoid that. It won't be flying past any choppers.
Vanya, thank you so much for your brilliant presentation. You are incredibly impressive. The work you're doing is incredibly impressive. Combining technology with our healthcare system, and especially in our remote communities in the NT, absolutely huge. We're a big fan of you, and we're going to be able to catch up with you a little bit later with our panel.
Thank you.
All right. Thank you so much. I hope all the viewers have got plenty out of that amazing presentation by Vanya. Just to remind you how to get into the next session, you click back into the timeline and then into the next session, and we'll see you there.